Hi, name's Paul.
Hey, Paul.
It's funny that your intro kind of fits what I wanted to talk about.
Well, that's because we paid you well, Paul.
No, never met you.
Hey,
Anyway,
it makes
I
for
was
good
working.
comedy.
I was working in my garage about a month ago on
Sure.
an old 20-year-old truck, and I had your show on in the background.
All right.
And I heard one of those wisdom pearls you mentioned earlier about flaxseed oil.
Cool.
See, I've been having these headaches for years.
All right.
3 years about. Went to a doctor, and they just gave me pain pills like hydrocodone. And after 3 years of that, I was getting pretty tired of taking those pills, and got that side effect of getting clogged up, if you know what I mean.
Oh, you think?
So, I heard your flaxseed oil thing, and been doing the tablespoon in the morning, tablespoon at night, and
Yep.
I'm feeling a lot better.
Cool.
But my brother had a stroke
All right.
over Christmas, and it kind of runs in my family, and I'm thinking, well, I better go get my arteries cleared out or checked out.
All right, cool.
I'm having a heck of a time with finding a doctor that I think is good.
Okay. Well, Paul, if I'm gonna get this thing right, so what you're looking to do is you see yourself as having a high risk for cerebrovascular accident or stroke. You have family history of it, and that's understandable. Okay, if you had a strong family history of rheumatoid arthritis, you'd be worried about that also. So what can you do in the immediate future, okay, to start reducing your risk of heart attack and or stroke? Because the treatment's the same, believe it or not. Well, the first thing that you want to do is you want to start increasing your intake of omega-3 fatty acids, not to be confused with the flaxseed oil, because it's not the same thing. You're taking enough flaxseed oil so that it's not being absorbed, and that's key. Okay, you want it to pass through as a lubricant. You were working on a 20-year-old Ford. Before you crank that thing up for the first time after 5 years, what do? You take the plugs out, okay, and then turn it over so that you don't end up with compression and start doing damage to the engine. Well, the first thing that you do with your crankcase here is you start decreasing the risk with omega-3 fatty acids. The dosage that you're looking for in the combined EPA and DHA is about 1,500 milligrams. That's daily, and that's not to be confused with the capsule size. Okay, this is very much like in working with your Ford. It would be like the weight of the oil, whether it's 10 weight 30 or 5 weight 30. Okay, that's the viscosity of the oil, the thickness of the oil. With the
Funny you say that.
Why? I was a mechanic before I was a doc.
I was thinking of that same analogy of before you even said that. Putting synthetic in my.
Well, we're not going to put anything synthetic into your veins. It works okay for the cars. It doesn't work so well for us. And but what you want to do is to start with the fish oils, and you do these things. You never take your fish oils simultaneously with your flaxseed. Because what it'll do is it'll keep the omega-3s from being absorbed. So you take your flaxseed separately, wait an hour, you can do whatever the heck you want. But the way to go with this thing is you kick up the omega-3s. Fish oil is just fine. You don't need the expensive krill oil product. It's just a waste of money. You have to take 20 of those capsules a day to get it to work. And then you start with that. The second thing you do is you take a baby aspirin a day. That by itself reduces your risk by 15%. Not doing that is very, very silly. Okay, so the omega-3s decrease your risk by 15%. The aspirin reduces it by 15%. Now, does that mean 30%? Probably not. It probably together it probably reduces it 20 to 22% because they're not independent of each other. And then the third thing you do, and this is really the most interesting one of the bunch, is you kick up your folic acid intake. Okay, and you're going to go, what the heck is that? It's commonly known as vitamin B9. The dosage that is necessary to get this done is not and has never had any relationship to what's called the RDA, which, by the way, means nothing anyway. Okay, 100% of your RDA is 400 micrograms. It's dumb. It didn't make any sense when it was first written. It makes no sense now. But at 5,000 micrograms, it starts reversing the plaquing in your arteries, and that's what's key to this. Okay, so you have to reverse the plaquing that helps the heart as well as the brain. Now, once you've got that underway, you're doing pretty well. You're 80% of the way there. What else would you want to do? It wouldn't be a bad thing to get a baseline CRP, which is one study that's done in your blood to see where you are. it'd be nice to have it. If you didn't have it, okay. But what you do is you take something called glucosamine sulfate, not to be confused with glucosamine hydrochloride, which is junk. Okay, the sulfate is absorbed, the hydrochloride is not. But what this does, it's one of the few things that's ever actually been found to reduce endothelial inflammation. If you can do those three things, you are so far ahead of the game, as to make it insane. Okay. Now the folic acid, if you buy the stuff at the health food store, you have to take about 12 or 13 of them a day. It's cost prohibitive. We have one in the office that costs $4 a month. It's the 5,000 microgram. It's 5 times the prescription strength. Okay, but we have it OTC. So Paul, if you can get started with that, my friend, okay, you too will be worked on when you're an old truck like the one you've been working on.